Greetings family. In today's knowledge, let's talk about what bacteria causes strep throat. Watch till the end. While I talk about Strep A versus Strep B, how long does it live on surface? How long is strep contagious? Is strep throat a bacterial infection? Yes. While many other types of sore throats can be traced to viruses, strep throat is caused by a bacterial infection in the throat and tonsils. What bacteria causes strep throat? Strep throat is caused by group A Streptococcus, or Strep B, according to the CDC. Strep A versus B. There are dozens of different types of streptococcal bacteria that can infect humans. Group A strep is one with a specific carbohydrate attached to the surface of the bacteria. Group B strep, also called GBS, is a different bacteria with a different carbohydrate on its surface and causes different infections. It is not a common cause of strep throat. Group B Streptococcus can cause serious medical complications in people of all ages, but especially newborns. The bacteria, which mostly lives in the gastrointestinal and genital tracts, causes GBS disease. The types of infections most commonly resulting from GBS are bacteremia, sepsis, pneumonia, and meningitis in newborns. GBS bacteria rarely causes meningitis in adults. If any of these infections become invasive, they can become quite severe, resulting in hospital stays and sometimes death. How long does strep throat last? This depends on treatment. Once antibiotics are taken, symptoms should improve within 48 hours. Can strep throat heal on its own? Yes. Strep throat can be healed without antibiotics. Strep throat can resolve on its own without antibiotics in several days. However, antibiotics are recommended to treat strep throat for many reasons. Antibiotics reduce the duration of symptoms and the length of time that someone with strep throat can infect others. Antibiotics reduce the chances of complications, such as abscesses of the throat, or rheumatic fever, which is rare, can be very serious, and infect the heart. What is strep pyogenes? Streptococcus pyogenes refers to group A strep, the strain of bacteria that causes strep throat. It also causes scarlet fever, the rash that sometimes accompanies strep throat. Is strep throat a virus? No. While many other types of sore throats can be attributed to viruses, strep throat is a bacterial infection that occurs when the throat and tonsils are infected with bacteria from group A Streptococcus. How long does a strep test take? There are two types of tests: a rapid strep test and a throat culture. A rapid strep test can be read in minutes. If this is negative, sometimes a throat swab will be tested by culture to see if the bacteria that causes strep throat grows. This can take 1 to 2 days, but is slightly more sensitive than the rapid tests. If the rapid test comes back positive, antibiotics can be prescribed right away, but if it's negative, you may still not be in the clear. The throat culture may end up catching an infection the rapid test failed to detect. Is strep airborne? It can be. Strep throat is most often spread by respiratory droplets from an infected person to someone they come into close contact with. So, if a person coughs, talks, or sneezes near you and is already infected, you may run the risk of an infection. How to get rid of strep throat? What are the treatments? Strep throat is treated with antibiotics. Patients should start to feel marked improvement in their symptoms within 48 hours of taking antibiotics. Medication will both limit spread of the disease to others and prevent further complications such as rheumatic fever. Also, take over-the-counter pain medications such as aspirin or ibuprofen to relieve symptoms, as well as getting plenty of rest, hydrating, gargling with warm salt water, eating soothing foods, and using a humidifier. How long does strep live on surfaces? While group A strep can be recovered from some surfaces, It is not highly infectious from a surface unless that surface was recently contaminated with respiratory droplets from an infected person. This makes it extra important to wash utensils and surfaces after a person known to be infected with strep uses them to prevent the spread. Streptococcus pyogenes have been found to live on inanimate surfaces for months. How long is strep contagious? It depends. People with strep throat can infect others until about 1 day after starting antibiotics. If untreated, people with strep throat can infect others for several days, perhaps even weeks. How to prevent strep throat? The best way to prevent strep throat is the same as with other respiratory infections. Best practices include good hand washing, especially after sneezing or coughing and before eating, staying away from people with symptoms, avoiding shared utensils and sharing drinks. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.